Happy Women's Day.
Happy Women's Day! Hi guys, my name is Jasmika Singh. I'm a Miss World South Africa finalist, and today on Women's Day I'm speaking to Prof. Carol Ann Benn. I'm so excited to meet her. You guys have no idea. I've been speaking to her for the last few months now, and she is just incredible.
The privilege is mine. When you reached out to me and I read your story and your background, it touched my heart. And anyone who does anything for the greater good of people, particularly women, and Happy Women's Day again to everybody, is really important for me. So my background is breast health and women's health, and I'm very much into women empowerment and taking responsibility for your health and your body, and also access to care. So you asked me how much time I've got, and I said I'm running between Brenters, and I have a free access clinic here on a Thursday. The concept is that nobody asks for healthcare crises, and we must make sure that we take cognizance that everyone has access to care. So whether you've got a medical aid or not got a medical aid, and we need to realize today that things have changed so much in medicine. So we don't have to operate on everyone. And a lady didn't want to wait yesterday, and I actually phoned her this morning, and she wanted to see a general surgeon. I said, but actually you don't need an operation. You've got such a lazy cancer, we can give you a hormone treatment and freeze cancers. The world is changing. I think what we need to know is we need to know our bodies are our temple, and wow, you look after yours really well. So that is a really good thing, and I'm glad in terms of what you're doing and inspiring other people. So what we need to do is know this is your body. You need to listen to it. You need to go for your health checks, but you need to know where to go if you have a problem. So for example, if you examine your breast, flat of the hand, check carefully, don't lift your arm above your head when you check for glands, and you see something you're concerned about, you need to know what's the next step. And the next step is to find yourself a breast center that's reputed and accredited, and get someone to examine your breast. Today we've got an amazing doctor. She's a radiographer who's got a doctorate in AI ultrasound. So we use artificial intelligence and ultrasound to check breasts, and we do it rapidly and quickly in a clinic environment. So we can start with really simple ways to assess what's going on. Then if we pick up a problem, and it can be, do you have a breast lump? Do we know what type of lump it is? And you don't need to start with the surgeon cutting it out. Sometimes a needle biopsy to tell you what it is. And if it's not a cancer, it often doesn't need to come out. If it's cyst, definitely, absolutely not. If it is a cancer, you need to have time taken in a multidisciplinary environment where you have lots of specialists, not 5 or 6 or 7 or 8, or people who only refer to their friends and one another, but a robust multidisciplinary environment. I had a very nice Teams meeting this morning with a unit we are going to partner in within the garden route and help them set up collaborative multidisciplinary. We've got different hospital groups, different doctors, and putting the patient first by, instead of doing what the doctor wants, listen to what all the options are, and then telling the person or the patient. Because today we treat breast cancer in terms of different behaviors, how they behave, and it's not necessary just that everyone gets surgery, and most people shouldn't get a mastectomy, and we're de-escalating care, so less, more personalized care. And I know you reached out to me because this is near and dear to your heart, because of what you went through with your mom, and I don't know if you've spoken about it, but I think that so many people have been touched by cancer and health crises, that it's really, really important that what you and people like yourself do is making awareness out there in the media environment is critical, because people access into it, and as long as they're picking up reputable sources like yourself and Breast Health Foundation, they are empowering themselves with knowledge, so they don't necessarily rush into the wrong treatments, and they take time. The first thing I say to everybody, it's your body, not the doctor's.
Yes.
Don't make decisions in doctors' rooms. Hear what everyone says. Go and think about it. And due to clever technology today, often we do feedbacks I do most evenings online team consults, which means you're sitting in your own home environment, asking questions of the doctor, so there's not this concept of sitting in the headmaster's office.
Yes.
Yeah. So you see all our consulting rooms, okay, and both units aren't geared towards a desk and vertical medicine, but really about a horizontal medicine and about patient in the center and all the options around, including things like pre and rehabilitation, life coaching around managing medication, around exercise oncology. Know that today that what you do is, if you exercise and you're decreasing your cancer risk by 42%, and if you are got a cancer and you're exercising, you decrease your chance of the cancer coming back.
Can I actually just say, you mentioned something earlier about how it's so important that we raise awareness and we speak about these issues. And the way that you said it, it reminded me when I started with this pageant, I really was, definitely breast cancer is going to be the focus. Use the platform to speak about breast cancer.
It's personal for you.
It's personal, and the thing is, everyone knows someone that's been affected by breast cancer. But everyone used to tell me, why are you doing that? No one cares about breast cancer like that. And honestly, when people said that, it really like reinforced for me that this is what I need to focus on, because people really don't know how much it impacts lives and how much it impacts individuals.
And I mean, you have it personally in your family, right? Okay. So the personal impact is not just the someone you know or you've heard of, your neighbor, your friend. Breast cancer affects not just that person, but it's a bit like a potato in a bowl. That ripple effect, it affects the partner, whoever the partner is. It affects the children, okay? It affects the parents if it's a young person. It affects the person's ability from a work and a home life balance. So one of the teams I did last night, the lady said, no, okay, so she's going to have more chemo and she'll be down the whole weekend, but the upside is she's going to sit and watch the Olympics. So, for me, it was just so heart touching because it's so difficult, and having support around you and understanding, and then realizing not just the impact on the person's life who's going through the cancer journey, but realizing the changes people need to make in their immediate life environment. So people often say to me, I always say, choose your ghost busting team, which is what you're doing here, carefully. The people who you surround yourself, Breast Health Foundation, be careful of, oh my God, I'm so sorry, my aunt died, my this, don't do this treatment, this will kill you. And what you want is you want a support structure and team, and you want people to say, how can I make a difference? Maybe it's about driving someone to an oncology treatment. Maybe it's about working out, can we fetch and carry kids from school on that day that you're having treatment? Can we make a meal? Okay. Instead of filling things with negativity. I'm just back for a whirlwind trip around the US, and I love coming home. We have an amazing country. I wouldn't swap it for the world, okay? And everyone is quick to go, here's this problem, here's that problem. And I always say, which is what you are doing, and kudos to you, how are you making a difference? What positive are you putting forward into the planet as opposed to sucking in with negativity?
Yes.
Yeah.
The passion with which you speak is something that I actually just want to touch on as well, is that this is really why I reach out to you as well. Everything that you do is what I want my career to be, or my future to be.
Well, we're looking forward to having a whole lot of youngsters we can hand over to. And it's not just being a surgeon or a professor or an oncologist or this. People who run units and change it can be anything, coming from any background. It's about looking to see how you can work as a team and organize, that you can put the people who are having the health crisis first. From an organization point of view, that is what makes leadership in the wave and change. So I think last Friday or something, Dom, who does medical IT, and said he actually runs the whole accreditation on everything. He's got a whole medical knowledge, pure by of just absorbing it, but he's not a medical doctor. But he will know exactly what's right, not right, etc. Speak to Louise. Louise has been in this game for so long, she can smell when something is medically not right, okay, and knows quickly how to, in a nice way, say, how about you take time looking at other options? That's all we want to do. You know, we don't want, I saw a lady on Monday night that already taken off half her breast and I hadn't done that. And it's like, it's a bit late. Yes, we can try and patch and repair, etc. But go for your tests. Take time understanding the costs around biopsies. Make sure that people aren't rushing you into an emergency needle biopsy. Know what the cost of that VAB and that this, etc. They're not all the same, okay?
Yes.
Have things reviewed in a clinical radiology meeting. Have things discussed in a multidisciplinary environment. Don't be shy to go for second opinions. Don't be shy to question the medical doctors. Have an understanding what treatment plans are. We've de-escalated care, so not everyone needs chemo. We've got target treatments, we've got fancy stuff. You need less radiation. You can have radiation theatre. I spoke earlier, we can cryo and freeze cancers, okay? So there's so many options available, and you need to take that time. What we learned in COVID is that because it's an accredited unit, we all have to put together presentations and international presentations, and then the person who has the highest rating on the presentation goes to present. I had put together, looking at pre, during and post-COVID, the different biologies of cancers we saw, because so many people said to me, I've got this cancer because of the vaccine, or this because of this, etc. We actually saw no difference.
Right.
Before, during and post in terms of numbers and types and age, okay, which is actually an indictment to the lack of screening we see in this country. But there was a very nice presentation out of the UK and the US looking at delay to treatments during the COVID and the lockdowns. People who had a confirmed diagnosis but couldn't access care. And for the vast majorities of the cancers, and I'm not saying this to suggest people delay, but for up to 6 months there was no difference in outcome. So I'm not saying wait for 3 months or wait for this, but what I am saying is don't rush into treatment the next day. And anyone who tells you it's an emergency mastectomy, no one dies of cancer in their breast. It's cancer's ability to spread. So you want to understand how it's going to behave, and oftentimes starting on some form of, and it can be a hormonal manipulation treatment or something, you get an idea of how the cells are behaving.
Yeah.
And that is actually far better. Yeah.
So someone actually asked me, when do you start with your, let's say, early detection? What kind of scans are you going to go for?
Okay,
Yeah.
so as your bodies grow and develop, know your bodies. So young girls or young boys, as your breasts start developing, know that they develop in an asymmetrical fashion. You get a breast bud, no one was put needles into it, it's a little hard nubbin from which the breast develops, and you can have changes in size and symmetry of the breast. But get into a habit, stand in front of a mirror, lift your arms up, recognize, have a look and see, is that a funny looking mole, okay? So you want to check and know what's going on with your body. If you feel a lump and you are young, you go for an ultrasound. Sometimes you don't even need a biopsy. If they pick it up for the first time, you do a 3-month follow-up sonar. So you start getting into the habit early on. If you're a young girl, okay, before you're sexually active, have the HPV vaccination. We know that there's a new one, Gardasil 9 out. In fact, I must remember, will you remind me, Tanya, I must get it for all. Even my boys get vaccinated, okay. In Australia, it has significantly decreased cervical cancer across the board. So vaccinate, absolutely. Then go for your pap smears if you're sexually active. Do your health checks. I see breast cancers, I see other cancers in youngsters of 18, 21, 23, 27. So it's not, it can't happen to me, and that's actually a nice little aside. We quick to say, oh, it's not in my family, it can't happen to me. But think about what happened also, use analogy during the SARS-CoV-2 pandemic. So the virus is out there. There is no question that everybody had to be exposed.
Mm-hmm.
And you can't lock a virus up. Some people had no positive tests, never got sick. Some people got mildly sick repeatedly. Some people got mildly sick once. Some people got majorly sick. Some people got majorly sick and died. And whereas when we look at the studies, when people who had these risk factors were more likely to get it, it didn't happen all like that. You had fit, young, training people who died, and you had people who were diabetic with lots of comorbidities and obesity and this who didn't. Okay, so it's a bit like cancer's a bit the same. So only about 8 to 12% of people with cancer have single genetic abnormalities, and you want to know family history. Lots of cancers in the family, young people with cancers. Between about 10 and 30% have combination genes. So we, at the moment, not so medically clever at working it out. So you see a family and it's a bit like, auntie is this, uncle is this, cousin is this one is this. You see lots of cancers in the family, not necessarily of the same type, but you can't work out the genetics. Those people must screen for all those cancers: stomach, colon, thyroid, gynae, men, prostate, testicular. But 65% of people who get cancer have no risk factors whatsoever. They've had children, they've breastfed their children, okay? They don't have excessive bad habits and they get breast cancer because every time a cell divides, it has little abnormalities on its DNA. And the first couple of divisions, the repair genes, that people who have genetic abnormalities, they're supposed to either fix it, slot it in, or if they can't, the cell gets killed. If that doesn't work, as the cell continues with its abnormal growth, the microenvironment, the environment around the cell is critical. Those are like little hyena cells that go, you don't look normal, we're going to kill you, okay? If they don't recognize it or they can't kill it, then that grows into its own little cancer plant. So that's how it happens.
And so, sorry.
No problem.
Another question.
Yeah.
What would you say then would be misconceptions about breast cancer that a lot of people have?
So I think there are lots of misconceptions. So we've touched on the fact that it can't happen to me, and we've touched on the fact that you're too young, too old, wrong ethnicity, race, sex, etc. It can happen to anyone. Okay. The next thing to touch on is the fact that we have all these myths, and they go in waves. Cell phone in the bra, underwire bra, lipstick. Someone trauma to my breast, that's what caused the cancer. Myths, and myths, okay? What are the other misconceptions around breast cancer? That you need to have your breast off, that you must start with a surgeon and rush into treatment? Absolutely not. Myth is that everyone gets chemo. Absolutely not. Very nice article, the SEER data looked from 2000 to 2009, and they compared people who had a breast saving operation with people who had a single mastectomy and a bilateral mastectomy. And even if down the line you get a second cancer, it has no bearing on your survival. So do less is more, smaller things. More is more. I had a lady in tears in these rooms the other night. Bilateral mastectomy, failed reconstruction, her marriage has ended, divorce, etc. And she feels it's because of the procedure. Okay, so there are many other factors that come into play. But don't rush in to do major stuff. There's a field now at the moment called ERIS, Enhanced Recovery After Surgery. There's no question, the bigger the operation is, it drops your immune system and it impacts on everything. Brain cancer, you name it. Less is more, smaller, take time.
Is that even with, like, if someone has a
metastatic cancer?
Yes, yeah.
So even then with metastatic cancer, which means cancer that's spread elsewhere, and that is another myth. It's when we talk about death sentence, life is the death sentence, okay? People who have secondary cancers elsewhere can live long and healthy lives, like people with diabetes, and sometimes it's not easy managing through and going through repeated oncology treatment. So I'm not making light of it, okay? Life is a journey, and for some it's a climb up Kilimanjaro, and it can be every day, and for some it's that meadow and forest, etc. But believe me, even in the meadow there's a hole or a poop that you stand into, etc. It's not straightforward, okay? But what I am saying is, don't think because you've got secondary cancers with the way things are going today that you can't be helped. What we need to do is listen to the person, okay, and hear what they want. So life is also about quality and quantity. So whether you've got a bad rheumatoid arthritis or a severe depression, or whether you've got an insulin-dependent diabetic with complications, or a cancer, or you're a cardiac cripple, we need to hear how we are making life quality livable with access to the right treatment. And treatments are improving and changing all the time. But with metastatic cancer, it's very much less on a surgery point of view. You want to do, and sometimes you don't even operate, okay? Small procedures, small surgeries, freeze tumors, or not operate at all. Because your management is then like with diabetes, you're managing medically the condition, okay?
Okay, and then in terms of, you mentioned that you have an accredited research unit. So the research people that are watching, yes, so this clinic is internationally accredited, and I wanted to speak to you about your journey in that. I mentioned I always knew I wanted to do breast cancer, but you're doing, as I said, exactly what I wanted to do. I wanted to do oncology.
Looking forward to handing the baton over.
I wish, but so I haven't done oncology, like I haven't done any sort of medical degree in that. So I would have liked to have someone like you speaking to me about this when I was, deciding in the trick.
But you know what? It's never too late, and the thing is, it's not about being a medical doctor. So you can be you can do a clinical associate thing, and you can run a unit. The running of the unit is about the person who has passion and integrity and responsibility and leadership in it, which you show, all those characteristics. That's what you do. It's not about, it doesn't have to be the surgeon. In fact, ideally, I think it shouldn't be. And it shouldn't necessarily be the oncologist. It needs to be somebody. So probably one of the people here who best coordinates the unit is the head of IT, accreditation, Dom, and Zama. And the two of them together ensure that the doctors are behaving and doing the right thing. So know that. And you mentioned the fact that you wish you had known when you'd finished matric, etc. Probably one of my biggest passions is mentorship. Okay, and it's also understanding. I think the biggest lack of mentorship is when people leave school for the first 10 years, because what happens is in school, you've got to go to this class and this class and this class and that subject and that subject. You are following what you have to do. You come out and everyone asks you, do you know what you're going to do? Are you going to university? And A, you don't need to know what you're going to do, and B, you don't need to go to university, okay? There are many ways that you can have successful, happy careers by not doing that. And what you want to do at 19 is not necessarily what you want to do at 25 or 35 or 45 or 57. I could turn around, I've shown you my very bad charcoal sketch, and turn around and say, actually no, I'm handing over baton and I'm going to do art and writing and this and that. You want to know you come to work fulfilled, okay? That you're enjoying what you're doing with your days. We're talking about cancer and how quickly life can change and everything. For heaven's sake, okay? Yes, we need salaries and bread on the table and this and that, but being grumpy and upset and this is a horrible day and I'm not going to enjoy, what's the point? Sometimes I think also we chase the wrong thing. Too many fancy jewelries, fancy cars, how many pairs of jeans do you need, etc. A simpler existence and maybe an understanding of the absolute beauty of the world we live in, and putting something forward is what it's about.
But it's like the positive attitude, the optimism.
Absolutely.
I really love that. Like that message is something that I really like to speak about a lot. So it's really nice to hear you say that as well.
Good.
So you spoke about not doing too many expensive treatments and very invasive treatments.
Yeah.
And something that I thought was so incredible when I was speaking to Oma as well, she spoke about how obviously we know it's very expensive to have breast cancer and to try and treat it normally.
Yeah.
And you assisted her and you've assisted so many people. Yeah. So would you mind speaking a little bit more about that?
So I think that it's about personalized treatment care. And for me as a surgeon and someone who runs a unit, I honestly believe that it's not about private practice and making lots of money. It's about, I will see people if they don't have access to funding and work out what's best for them and offer that type of advice. And if I can, there's set rules around how things are done, and they're run by Breast Health Foundation, thank God, and sensible people who we can operate at a reduced rate or at for nothing, etc. That's important.
Yes.
Because I don't want to sit here going, oh, I'm only seeing people who can pay, and then why did I do medicine? Okay, that Hippocratic oath that's sitting right there is there for a reason. It's a service profession. It's do what's right, okay, and offer the correct service, and it must be available to everyone. Okay.
That's made me very emotional. I mean, hearing you say that, really.
True.
Yeah, I mean, like to sit and speak to someone, it's really about the passion.
Yeah.
And so, how can someone gain access to you like that?
Okay, so usually, most people have access to my cell and I get WhatsApps all the time. But from a sensible way to do it is contact in with Breast Health Foundation, and they work out what's best and help out, and they have care assist lines and webinars and information, etc. Because sometimes it's not necessary, but you don't maybe need to even necessarily speak to me, that between Louise and the team of navigators, they can solve the problem.
Mm-hmm.
And I'm quite special needs, so I know so much about a little, and they often know better in terms of access and information, etc. But yeah, so happily and available, and we're in it together, we're a team.
Since we have this platform now, if you could speak to other influential people and sponsors and stuff like that, what would you ask them for, and how could they help in increasing your outreach?
100%. So we have a soft opening of a new BCCE at Brento, sponsored by Life. They're amazing. Love with the CEO, love with Johan. That put 6 million into unit of the Brentos, which will be for people with access to medical funding, some of the low-end medical schemes as well, and people who don't have access. So what would I say to people, and then there will be probably an auction in November, is putting effort in is not necessarily about putting money in. Sometimes you have equipment, expertise, sometimes doctors helping out, nurses helping out. It's people are always very, very nervous when you say, oh, someone's going to come to me and ask for money in my checkbook. So most companies have corporate social responsibility, and I would reach out to them to say, work out how you can tie your corporate social responsibility in. I sat with Louise last Friday. So Breast Health Foundation is an aspect of looking at breast that you're involved in, but the greater picture is this concept, and we were talking about it, and Dom, the IT guy, actually came up with the idea. You know, I've written on the Big Five in healthcare, and in fact the National Health used that as their screening program, like the buffalo, the leopard, the this, that. And to come up with a concept, we were talking about the reason behind the Big Five were, and I save ants in the wild, so the concept of shooting something just rolls me over. But was what people would hunt on foot, I think. Am I right, Lou? Like the buffaloes and elephants and etc. And the concept is we're hunting on foot around what are health issues that affect people. Women's health issues are breast and cervical. Women's health issues are also women and child abuse and maternal health. There are issues such as men's health. So there are many things that we as a community need to hunt on foot together to make sure, and people can be involved in that, to make sure we make change and difference. Because the two most important things are what we're doing here education to people. That's the most important.
Mm-hmm.
The second most important is health, okay? Because without your health, you've got nothing,
Mm-hmm.
okay?
Yeah.
So that's
incredible.
Yeah.
And then what advice would you give to young women, just people in general?
So listen to your body. I know it's frightening. I mean, I woke up this morning and I was like, oh, I had a night suit, and I was like, oh, what's in my hip? And then you stumble out of bed and try and get yourself. So you listen to your body. If you've got problems that are occurring repeatedly, make sure you find suitable, responsible people to assist you from a health point of view. Make sure that you find the right platforms around education, such as this, okay, and put something positive out there instead of taking something. That would be my advice.
How can you support someone that has breast cancer or has survived breast cancer?
Okay, so I think support from a lay navigation point of view, which is what it is something that has to be done carefully and cautiously. So I mentioned earlier, you can support people by driving food, helping out around the home. You can recommend second opinions and everything, etc. You can contact in with organizations who are trained, such as Breast Health Foundation, etc., because we must always be careful what comes out of our mouth. I'm surprised how often people go, oh my God, I'm so sorry, my auntie died, or something like that. So support is about what Tia always says to me, quite cloudy, inside voice, okay? Think before you speak, okay? See how you can help, okay? And be careful enforcing your will on someone else.
Yeah, 100%. What is another challenge that you're facing in the clinic at the moment, and how can other people help with that?
Probably more medical staff. More doctors would be useful. If people were interested in getting training around women's health, they could come and help me out in the clinic. So at the moment I'm running between Liz at the Brain Test and clinic, back and forth and other meetings, which I'm happy to do, okay? There are often youngsters out there and young general practitioners who are interested, and well, then it helps you grow your practice, okay?
Yes.
So that would be great.
That would be fantastic. Thank you so much. It was such a pleasure meeting you.
Absolute pleasure. My pleasure.
Thank you.